I'm Larry Parrish, and I'm the Executive Director for the SHINE CDC, where the SHINE stands for Sharing Hope in a Negative Experience. Wow, we've got a great V talk for you tonight, but before we do that, let me open with the word of prayer. Father God, we do thank you, we do praise you, and we do magnify you. We thank you for this V talk tonight, Lord. We thank you for all the lives that will be changed by it, Lord, and we give you the praise, we give you the glory, we give you the honor. We thank you for the very visionary from Dr. Jazz who came up with this thing called Shine. And the Shine stands for sharing hope in a negative experience. And we know, Lord, that you can share hope in whatever negative experience that pops up because you are the solution. We give you the praise, we give you the glory, we give you the honor. It's in Jesus' name that we pray. Amen. All right, V Talk listeners. Now, I'm going to introduce to you our host for tonight. Her name is Dr. Nicholson, and she's going to lead the V Talk for tonight. And I tell you, you're in for a wonderful, wonderful experience tonight. So I'm going to come back a little bit later when we do the Q&A, but I'm going to actually turn it over now to Jackie, Dr. Jackie Nicholson, and she'll take it from here. Good evening, Dr. Jackie Nicholson.
Good evening, Deacon Larry. Thank you so much for the prayer.
Thank you.
All right. It's a victory evening, everyone. Tonight on our Wednesday Wellness V Talk, we are going to discuss how the pandemic has affected patient health care. Join us as we have two amazing, intelligent, beautiful African American women who are experts in their fields, and they're going to bring us information on telehealth and on mental health and how these two things have changed over the COVID season. All right. First, my first guest is Sarah Clark. Sarah Clark, who is the Director of Health Care Services with Rosen, Saperstein, and Friedlander. She leads many of the company's healthcare consulting engagements, helping a broad range of independent medical practices, hospital-affiliated practices, community medical practices, and public health departments reorganize, strengthen, and streamline their businesses, infrastructures, and operational practices. Ms. Clark has over 20 years of healthcare administration experience working at the executive level with hospitals, physicians, and third-party payers. Welcome, Sarah.
Thank you, Dr. Nicholson. And it is, sorry, forgot to show my video. Thank you, an honor to be here tonight. And it's indeed a victory evening.
Yes.
I'm happy to bring information on telehealth services.
Oh, thank you so much. So our pastor, Dr. Jazz, has been speaking about pivoting, right? And we've seen a lot of pivot in the country based on the pandemic and everything. So telehealth is definitely on that cutting edge of pivoting and changing how healthcare is looked at right now from patients. So tell us exactly, what is telehealth?
So telehealth is the use of digital information and communication technologies, such as computers and mobile devices. It gives you access to healthcare services remotely and manages your healthcare. And these technologies you can use from your home, or your doctor can use them to improve or support your healthcare services.
Okay, so what type of services are offered through telehealth? Like, why would I choose to use telehealth?
Yeah, well, it's so incredibly convenient. So some type of services that you can get are your office outpatient evaluation and management services, consultations, medication management, triage services, counseling, follow-up on appointments, addiction treatment, and behavioral health, in particular psychiatry and mental health, are like the top three specialties using telehealth even before the pandemic. So, and you can access your doctor or provider through either video or telephone communication devices, as long as it's through a HIPAA compliant vendor or a smartphone or a tablet technology.
Oh, okay. That's awesome. All right. So yeah, so you said it's big. So the mental health physicians and clinics, they've been using this prior to getting to the pandemic.
Yes, and even more so now. I mean, once the pandemic happened, most of your behavioral health services went close to 100% virtual for a while, and now they're still providing a lot of their services virtually.
Okay, so so like, can you walk us through like an example of, say, I was looking for, I see my family practitioner, and I wanted to, um, I was fearful. I didn't want to come into the office, but I want to talk to them about a rash that I had on my arm. How do you go about setting up an appointment through telehealth like that?
That's a very good question. So there's basically three ways that telehealth is used. One is a patient contacting a provider. Another is a provider contacting a patient. And the third way is provider to provider. So if you're a patient and you want an appointment through telehealth with a provider, you can call that office, or you can even go to their website. A lot of them have the option where you can go to the website and schedule a telehealth appointment, or you can call the office and schedule a telehealth appointment. And then there are some online virtual websites where you can go and have a telehealth visit almost, in real time.
Okay, so how do I know if my doctor is in the telehealth network?
Their website generally will let you know. So if you go to their website, it should inform you that they have telehealth services, and even give you the option very often on the website to schedule a telehealth appointment. But if you go to the website and you're not sure, you can call the doctor, or you can even call your insurance carrier and ask them.
Okay, so you can call your insurance carrier, or you can even call your doctor. So now I call my doctor and they're not on telehealth. But, how do I, how do I get the doctor information or express that this is something I'm interested in, because I just don't want to come into the office?
With the public health emergency, some providers are aware of this and some are not. But the insurance companies generally, because of Maryland Insurance Administration regulations, they have to use 92% of their premium dollars on healthcare services. So resulting from the public health emergency, for a while, patients weren't coming in. So a lot of that premium dollar is left in the bucket. And so they have been using those funds to help providers set up not only telehealth services where it's, remote E&M services, but also like remote patient monitoring, where there's remote devices that are placed in the patient's home that collects healthcare data that is then fed into the EHR of the provider. So I would say that if they have a provider that's not using telehealth services, to really reach out to the provider and say, that's what they would like, that because providers are interested in hearing what you have to say. And even to take it a step further, I would call my insurance carrier and say, I go to Dr. X, and I would really prefer that they have a telehealth option for my visits. And then that insurance carrier will reach out to the provider.
Okay, all right. And so should we expect the same if we get a telehealth visit, the same copay, all those things still apply?
They still for now, and we predict that that will remain the same for most visits. The CMS has given the option of providers to waive co-payments and co-insurances if they wanted to, as some of the payers during the early stages of the pandemic were doing the same. But now most of the payers that I worked with anyway are now, it's the same co-payment as if you were an in-person visit.
Okay, so this telehealth sound is awesome. I've used it myself in the past, but also, so we're still, the vaccine is out now. People eventually probably feel a little safer going out. So where do you see telehealth being when the pandemic kind of clears up? Do you still think it's going to be just as?
Absolutely, it's definitely here to stay. It's like the cat's out the bag.
Okay.
Recognize that it's convenient. I can, like you, I've used it now 3 times since the pandemic, and I love it because I didn't have to drive to the doctor's office. I didn't have to wait in the waiting room. Literally, I got on the Zoom, or the provider Zoomed me, contacted me, And my appointment was quick and easy and the same results, as an in-person visit. And because telehealth really saves costs, when from even a provider's perspective, if they want to expand into a different geographic area, they may not need as many exam rooms because a certain number of their patient visits could be done through telehealth. So it's cost savings for the provider, it's cost savings for the patient. And, because it makes healthcare more accessible to patients, we predict that it's going to improve quality reports because you can reach more people and provide healthcare in rural areas, elderly patients who have a hard time getting to their doctor. You can even involve family members of patients that have a hard time getting to the doctor, or family members who have a hard time being with the elderly when they go for a visit. You can bring those family members in. So it makes healthcare services more comprehensive and accessible.
Okay. Well, one last thing before we end this segment, so you talked about insurances, right? So what if a person doesn't have insurance? Do they still have access to use telehealth?
It would be the same. Unfortunately, it would be the same as as before. If you don't have insurance, my quick answer is no.
Okay.
Of course, a lot of the public health departments, in fact, Prince George's Public Health Department, I kind of take that back a little bit. Prince George's Public Health Department does have telehealth services, and they do provide those services to people who don't have insurance. But if you're looking at going to, your typical medical practice who only takes insurance, then the telehealth would not be available to them in that particular case.
Okay. Well, that's good to know there's still an option, at least with the county health. Okay. Well, thank you so much, Sarah. We're going to bring you back later for some Q&A from our audience.
Okay, thank you.
Thank you. All right. Next, we have our very own resident doctor, Dr. Sharon Allison Oddie. She's a speaker, an author, health educator, physician, and health strategist and consultant. She serves as the executive director of the Koshar Healthy Communities Foundation. She's an avid medical researcher with numerous publications and presentations. She's an advisor for both government and private sector on awareness and media campaigns. And she's an expert in the area of physician-patient pharmaceutical engagement. Thank you so much for joining us, Dr. Oddie, because you've had a busy week. I've caught you on a couple different things, the WebMD, the NBC4. So we just thank you so much for being with us tonight.
And I am so happy to be here. I love you all, and you guys are doing a great work, literally a great work for the world, and certainly the USA. So I love it.
Thank you. Thank you. All right. So last time you were here, we were talking about COVID, right? And so we kind of led into ending saying that we want to talk about the effects, especially on the mental health that COVID has had in the Black community, right? Because we've seen numbers, I saw on the new U.S. News report that numbers of the suicide rate in Blacks have increased, have almost doubled in Maryland just alone, where the white race there, who usually has higher suicide rates, theirs are actually going down. So what do you think is attributing to this increase in mental health as far as the suicides, anxiety, and the depression?
Suicide, anxiety, depression, feeling hopeless. I think our social isolation is a real issue. Many of us have coping mechanisms. I was talking to a friend yesterday. I love movies. I love the movie theater. I love to go out to a nice dinner in a restaurant. Well, you really haven't been able to do that. And so those are breaks and that we can take. And then you have the stress. Domestic violence is actually spiked during COVID. And then where do you go and how do you navigate that? I think it is the stress of a national pandemic, but it's not just COVID. It's also watching things on TV. We know that we've been bombarded with images from the Capitol. We had Black Lives Matter demonstrations, but more importantly, murders of Black men when we talk about Black, with Black men and abuse and Black women. And all of these things weigh us down and we get hopeless. And if you don't have something to hold on to, you can easily go down this road. And I just want to give a reality. Years ago, I did a program called Depression in Our Pews, because in the church, we often think, you know, Jesus is my rock. And if you're a Christian, you can't have mental health disorders. That is not true. That's not true.
I'm glad you
He's
said
our
that.
rock.
Yes.
But you can have, let me clarify that, Dr. Jazz ain't coming
Right,
at me.
right.
Jesus is our rock. But seriously, you can have, and that's why I'm so glad we're doing this program, mental health, please don't be ashamed of it. It's just
Right.
like if you have high blood pressure, diabetes, whatever, you're not ashamed of that. Mental health is a health problem, and we don't have to break it up.
Right. So, I mean, I'm glad that you said that because, of course, you know, yes, being in church, that is something that it's the Black community, period, right? It's a stigma. You don't want to get help. You know, someone in your family who probably, you know, for what you know, you're like, they're not the same. They're not, you know, but you just go by about your business. So it's not something that people think they can get out of it themselves. So how do we, like, if we have a family member, right, and they're going through and we see this, how do we convince them to seek professional help? Because we know that's a stigma.
You know that I'm an internist and geriatrician by training. So I'm going to go from that standpoint. If you had a family member that was short of breath, grabbed their heart, you know they have heart disease, what would you do? You would call 911, right? If you think they're having a heart attack or a major health crisis or they have cancer, and you all of those, you would help them get help. And you would first start by asking them, are you okay for real? Because we do that play stuff and we say, oh, are you okay? And you really don't want to know. So number one, open your mouth and ask and say, well, I think that you may be having some challenges. And what I like to do is say, hey, we all have challenges. I'm not 100% all the time, but I think you may need some help that's bigger than just talking to me. And so go when you have the conversation and say, these are some resources. Let's just have a talk and create a safe environment to have a discussion. That's first and foremost. So first is address it. Stigma is so big in our community. We feel like we're weak. Black people, minorities, we feel like we can't be, especially Black women. I'm a Black woman, so I'll say, we can't be imperfect. Well, again, you have high blood pressure. I want you to think about mental health just like you do any other medical condition and get some professional help.
Right. So with the pandemic, right, a lot of clinics and things did shut down in the beginning, right? And then they start to slowly open back up. But during that, some of the patients that were actually seeking help, they lacked care, they lacked their medications because all these places were closed. And I just saw a big story this morning in the Hampton, Virginia area, one that served like 5,000 people got shut down like overnight, and they didn't. So what do you do? And I know Sarah mentioned the telehealth and they were, mental health, but if they didn't know about those services because they didn't know, what are the places that they can seek help?
Number one, if there is an acute crisis, like a loved one says, I want to kill myself. And usually they don't come out and say that like that, but they keep saying, well, I'm ready to see Jesus. Older people say that all the time. I'm ready to go see my maker. And we say, oh yeah, Jesus be waiting. No, that's them saying, when you say I'm ready to see Jesus, you are saying I'm ready to die, right? And just to digress a little bit in how mental health shows up and depression and suicide shows up in the elderly, often the elderly will not pull out a gun or anything like that, but they'll stop. They have hypertension, diabetes, a bunch of other stuff, and they stop taking their medicine and they stop eating. That is a way that they're manifesting mental health issues, depression, and suicide. They know that the doctor has said, take your blood pressure medication or you can have a stroke or a heart attack, or take your insulin and they will stop that in an attempt as another way to end their life. And so telehealth is very important and very important in mental health, especially now. But one of the good pieces is if you have an acute crisis, call 911, go to the emergency room for emergency evaluation. You can go to urgent health care centers, but I do not recommend that because an urgent health care center cannot diagnose you and treat you with panic disorder. So they can say, okay, you probably have some panic disorder, go see somebody else. Those are initial steps. But certainly I want to make sure I'm clear. If it is a severe break, suicide, but not just suicide, panic and anxiety, shortness of breath, you feel like you're having a heart attack, go be evaluated by an emergency room.
Okay, all right. And we've seen an increase in the younger people, the teenagers now, because of the isolation and not being able to physically be with their friends. As to parents, what is your advice to them on how to try to work with their children and speak to them to get them to open up to so that they can see if they need, counseling?
Again, open your mouth and talk to them and say, how are you doing? I know it's hard. It's hard for me. And when you personalize it and say, well, it's hard for me. I can't go hang out with my girlfriends, and daddy and I maybe cannot go out, et cetera, et cetera. It's hard for me and I'm feeling sadder than usual. How are you doing? And then set up play dates. Some of my girlfriends have kids and they are being very creative. Zoom is a wonderful thing. FaceTime is a wonderful thing. Set up play dates, but talk to them about the isolation, the depression. And one other thing that I've read a lot about recently, cyberbullying. So in the middle of a pandemic, you have social media, more social media. There are more online, and now online bullying and all of that. And so you keep another eye on your kids online, because even now there have been reported cases of children that have ended their life because of cyberbullying. Those kind of things. But again, open your mouth and have the conversation, create activities, even in your house, games and things for you all to play and get to know your kids.
Yeah. Yeah. So what are some signs to look for in any of your loved ones or friends or even coworkers, right? What are some signs that you can look for that might tip you to say, I need to, have a deeper discussion with them?
Well, in the age of Zoom, just like if you were coming in the office and you saw your coworker was disheveled, hair matted, all that stuff, and it was a difference in what they usually were versus what they are, you can see that even now with FaceTime and Zoom. But more importantly, if they are sleeping more and they say, well, I can't sleep, or I'm feeling down, and you just kind of know in conversation with them, oh, well, I don't feel happiness. And I used to ask this all the time, what makes you happy? That's a wonderful question, because if you can't say immediately what makes you happy or what I like to do, we have some issues. And I used to ask that all the time in clinical settings, and that would tip me off, because it's called, I got to prove I'm a medical doctor, so anhedonia is the big medical school word, but you don't find joy or happiness or anything. And then just a change in behavior, weight loss that is excessive, weight gain that's excessive, increased alcohol use, increased marijuana use, and those product use that they casually talk about, or you just hear them or see them if they're in your household that, he used to drink 4 beers, now he's drinking 2 6-packs in a couple of days. Those are the traditional signs. It is harder because we're not together as much, but if you talk and have a conversation, you can kind of see, are you sleeping? Are you happy? Do you find joy in anything? Have you thought of hurting yourself? And it's okay to ask, have you thought of hurting yourself? And certainly if somebody tells you that I want to kill myself, or I don't want to be here, have you come up with a plan? That is a 911 call. He can be mad at you, she can be mad at you, but that is an emergency situation.
I know that in Maryland, there are some laws that if they're not a minor, you can't kind of force them to go and get that help,
Mhm.
right? So in those situations where you know someone needs therapy or needs to be, admitted or hospitalized for that condition, will 911, will they come and
Do an assessment.
get the service?
They-
Okay, they will.
Yes, they will come and do an assessment, and what you need to do is they will do an assessment if it is a total, what we call a psychotic break, where
Okay.
they're seeing things or whatever, and maybe want to hurt themselves or they're delusional, all of that, they will come do a assessment, and then they will assess whether they can do what's called an involuntary admission because the person is in grave danger to themselves. There are a lot of legal parts to that. But
Mhm.
yes, I would just say that if you're that concerned, that yes, you should call 911 and let the chips fall wherever they may, but that you have done all that you can do to intervene. And people often will say, well, I don't want them to be mad at me.
Mhm.
Well, do you want them to not be alive?
Right, right. All right. So as we see that, the pandemic has spotlighted a lot of inequities, right, for our communities, and mental health is one of those. So as far as patient health care, how do you see, again, it brought it to the forefront. So how do you see, or have you seen anything or heard of any plans of how they're planning on trying to bridge this gap to make sure that the African American community gets quality health care, especially in the mental health arena?
Well, the National Association of Mental Health, which is the group, and it's NAMI, NAMI, is
Yeah.
the national group on mental health that is primarily Black providers, has been working on this since forever.
Okay.
Other organizations are working on healthcare disparities in mental health. And so we continue to kind of push ahead, even in this environment. And we know that there are spikes. The question is there more depression? Is there more obsessive compulsive disorders, panic attacks, anxiety? Or because we are now isolated and you can't kind of act out and you are in your home, that you're seeing more? That I think we won't know for a while, that you're seeing more because you're in their face more. You understand what I'm saying?
Right, right.
And then these are all stressors. What I say is, again, if you have more than 2 weeks of feeling very down, depressed, and all of that, you need to seek help. So immediately call your primary care physician and say, I need some intervention. But then when we talk about African Americans, we need programs like this. We need churches. We need organizations to talk about, I can't say it enough, talk about mental health, but talk about it in the same way. I have been in church services where people talk about demons and it's demonic if you have depression. Well, what about that heart attack? Was that not? I mean, and so we cannot have this stigma choke the life out of literally us, and it's more than being a little blue. So all of these initiatives are going. I do recommend telehealth, Zoom. A lot of behavioral persons are have a very active telehealth program. And one thing that I actually have seen, you talked about this in the other segment, is that actually, and I'll tell you a secret, doctors take cash, credit, or check. Many of them did not check as much. But behavioral therapists and all of that, usually for about, and I'm quoting from Maryland, DC, Virginia, about $75. If they take a health insurance, often they will take cash payment because it's actually easier. And
Yes.
you can do that. And so one thing that you can do if there's no insurance and you know a loved one is in trouble is that you gift them with a few sessions with a mental health person.
Oh,
And just call.
that's a great idea. Yeah, that's a great idea. Okay. Well, thank you so much for answering our questions tonight about how this has affected mental health. We're going to bring Sarah Clark back on, and I think we have a few questions for you both.
Wow, awesome, 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 awesome. The questions are coming in. So let me start with Sarah Clark first. Is the quality of care the same as in person?
Yes, it is. The quality of care is absolutely the same as in person. I've had a primary care through telehealth personally. I've had an orthopedic appointment virtually through telehealth, and my son had a dermatology appointment through telehealth, and it was the exact same type of appointment that I would have had in person.
Okay. We got one more came in for you, Sister Sarah, and it says, is telehealth private and secured? That's a good one.
When initially through the public health emergency, CMS were allowing, non-HIPAA compliant virtual communications, but medical practices and organizations now absolutely have to move to a HIPAA compliant, cyber secure platform to provide telehealth services.
Awesome. Okay, Dr. Sharon, we got one coming in for you, and it says, can people refuse treatment if they really need the treatment?
People can refuse treatment, but if it is, and we're talking about mental health, if it is deemed that you are a threat to yourself, and say you've called 911 or you take them to the emergency room, they will be evaluated by mental health professionals to see if they are at risk to themselves. And then you can get a temporary order that is temporary to restrain them, not restrain them, but to commit them. We used to say commit them, but to admit them to an acute system. And it's not forever. So a judge will have to rule on that in a few days, et cetera, et cetera. But yes, if they are a threat to themselves, that is the next level. Now, if this is major depression, but they're not suicidal, it is deemed that they are not, yes, it's bad, but we cannot override a person's free will. And so, yes, they can refuse treatment, medication, et cetera.
Okay, let's stay here for a second because I think this one is good too, Dr. Sharon. How do you convince a family member to accept help across a Zoom or a FaceTime platform?
The same way that you would show them address via instant message, the same way you would say, what you think about this, ain't this cute, et cetera, et cetera. Don't be so heavy. You know what I mean? Say, look, I'm worried about you, da, 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 I love you, bring up a funny story or something, but also pull them in. We know that if we can do ministry as you all do via Zoom, when we ain't in the church and able to flip over cartwheels, then we now have been creative that we can bring people in. And I've certainly had girlfriends on Zoom situations that I felt like I was right there, baby showers, all that, but don't be so heavy. And then you hit it and say, I love you enough to care even on this Zoom. And you're gonna have to do something, because I'm Dr. Sharon, we're gonna have to do something. You're gonna have to do something. And those are ways, but treatment, I wanna be very clear. Behavioral medicine and psychiatric care over Zoom is extremely important, particularly around stigma, because you're not having to walk into a mental health facility. And so though there are positives associated with getting help via Zoom, the privacy and all of that, and the one-on-one, nobody's in the waiting room, et cetera. And so talk to them, talk to your loved one about that and say, well, here, I found someone that you can talk to, and guess what? You don't have to leave your house.
Wow, that's good. And it's funny you should say that, Dr. Sharon, because I have a mentor group that I do, and it's one of the parents, she reached out to me because her eldest son was murdered, and the younger son is now in college, and it's really affecting him. And she was like, Larry, I think it's affecting him mentally. So what you're saying is absolutely true. So I guided her down the right path so she could get some help for her, because I said, we're not going to lose this one.
And, I want to just give a personal note. In 2015, I lost my father. And here I am talking about mental health, talking about grief, doing grief conferences, all that, and took a sabbatical for literally didn't do any public appearances, anything for about 6 months. And I literally woke up and my girlfriends were like, Sharon, Okay, I know you're the expert, but you're gonna need to talk to somebody. And I saw a grief counselor myself, and then have come out public and say, yeah, I talked to somebody, because how we deal with grief leads to and can lead to long-term depression. If grandma is still grieving grandpa and crying every day 5 years out, this ain't grief. She's has major depression. So thank you for that.
Thank you. Dr. Nicholson, you want to ask the next question?
Yeah.
More coming in?
No, I had a question about getting their prescriptions. Can you still get prescriptions through the telehealth?
Yes, you can. You can have medication management. You can get through telehealth as well as audio communications with your provider.
And let's see, do we have another one? No, I think it was a question like if you have a teenager, and I think we answered that earlier about them needing help. Now, can you force your teenager? Now, I know you said people can refuse, but can you force a teenager or a minor to have to go to treatment?
Yes.
Oh, you can. Okay.
Yes, you can take them now. How much are they going to engage? And all of that is something else. But yes, if you have a minor, you desperately need to make sure that they get help. And also, I want to be clear, just like every nail polish, y'all know I just keep it basic. Every nail polish don't work for everybody. Every therapist does not work for everybody. And so make sure that you understand that they may have a role or a way of doing things. I actually, like a psychiatrist and a psychologist, talk therapy, as well as don't just give my loved one pills. I want them to talk to someone and have a holistic approach to how we're going to fight this, right? So just know that you can shop around for any and ask for recommendations for any evaluation. Certainly, if you're in the DMV, you all can go to my website and contact me. I will definitely give you the grief counselor that I use, but also you talked about men have a different road. So young Black men, I am sorry, I will say it, young Black men often need a Black male therapist. And I know some of the best in the country that break through and are specialized in this area.
That's good. That's good. Yeah, definitely have to have more conversations. I think conversation and people being transparent and sharing their own struggles kind of gets people to say, you know what, I think I'm gonna try counseling, or, it doesn't have to be what might be minor to somebody.
That's right.
We think is minor is a major stop for them. So that is very good. And I thank you for your transparency for that. One more question just came in. It said, what if you have a family member who is in denial about needing mental health services? How do you get them help?
That's most people. Y'all know that Aunt Lulu that had some obsessive compulsive disorder and she's seeing stuff. Y'all know and she's in denial. Now, y'all know all of us got some people. I know my own family, right? And so it's usual, it's common. So when you talk about the schizophrenia or schizotypal and seeing things, that's something, again, you are not gonna think that you have a problem. You think everybody else has a problem. When you talk about major depression and you talk about how you feel, you actually, if you start to pair up physical symptoms with mental health symptoms, that's another way to get through. Well, I notice you're tired all the time. Let's go get you checked out. And then you peep the doc and say, by the way, I think there's some depression or whatever. And so how do you, if they're in denial, find a way to just say, and again, use yourself as an example, use others as an example. And then finally, I do want to, if I have time to just put this in here, make sure that in our elderly, again, depression shows up differently in the elderly. So, or decreased eating, memory loss. You cannot diagnose dementia without assessing for depression first. So you think grandma got Alzheimer's? No. Grandma has depression. And when you treat the depression, you see the memory loss gets better. So we have to have a holistic view of this.
Yeah, that's it. But as you're saying this, I'm thinking of my own family. Because when you
Mhm.
say about grief, my grandfather had passed, and my grandmother, she stopped doing anything.
Right.
You know, she's 87 now, and she's in pretty good health. Just has a thyroid issue. But when I say she stopped doing anything, she stopped driving. She stopped caring for herself. And I think then the dementia set in. But I don't think she's ever got treated for the depression. But that makes a lot of sense to why she's still in the same situation. So yeah, thank you for that. I'm definitely gonna call my mom and my aunts tonight. It's like, hey, you guys need to probably take her in and get evaluated. Yeah, thank you.
I got another question. This is from me, Dr. Sharon, to you. So where I'm concerned is I even want to go to elementary school and to middle school, and these kids have not had that interaction with each other. Is there a study to see what's going on with these kids in elementary school and middle school when it comes to mental health? Because I think sometimes they get overlooked, and that could be the very population that we miss in suicide actually occurs.
We have two issues. One is one is pre-COVID. So before COVID, we had issues with the mental health in our young people because they walk in the door, they may be clean, they may be not, they may be in an abusive situation at home. You don't know what's going on at home. Or they may walk in the door and be bullied. Racism, we know, sexism, we know. And again, total bullying and those things. And until you have open dialogue, teachers, actually, I mean, I had a teacher that in hindsight bullied me. And I mean, I was a bad little girl sometimes because I was bored. I was smart and she wasn't teaching me right. But anyway, she bullied me. But my parents had to intervene. That's a whole nother story. My daddy had to call up there and say, look. But my parents had to intervene. And so you have all those issues we know before COVID, the whole bullying, cyberbullying, and talk to your kids about what's going on and talk to their teachers. A squeaky wheel gets the oil. I don't care if it's virtual or not, a squeaky wheel. So you need to talk to them. That's pre-COVID. Now, post-COVID, the isolation, I'm really worried about what the data is going to show, and I've seen some preliminary stuff. The isolation, literally, you can't go on the playground. You have no physical interaction. If you're an only kid, you're in the house by yourself. That is not good for anyone. Or even think about our churches. The youth ministry of my church is one of the most active. They always doing something. All of a sudden for 2020 and now early 2021, nothing is going on. So again, we have to talk about it and we have to open up the bottle and say, hey, what are you feeling? What are you doing? And how can I help? But I'm very worried about that, Deacon.
Oh. All right, Dr. Jackie, I'm gonna let you take this last question before we close out.
All right. Last question says, in analyzing all the details, why do you believe the numbers continue to be high with accepting a mental health defect among African Americans? And do you believe it to be inherent and hereditary to the cultural upbringing of our ancestors, or the belief that there's a lack of education among the seriousness of these diseases associated with mental health?
I've spoken on this and written on this so many times. One of the reasons why we have stigma still in African Americans is, and I hate it, it's a double-edged sword. You have the belief that we are strong and we can get through anything. We don't kill ourselves. Y'all know, y'all not heard. We don't do what white people do. We don't kill ourselves like that. White women that came to take nothing. Black women can take everything, right? It used to be in the ICD-9, which is the diagnosis coding for medicine, certainly when I was in medical school, called the angry Black woman syndrome. And that was a syndrome of depression and expression of depression. So we go to, and I've been very public in talking about this, we go to Kroger or Walmart or whatever and get mad at the cashier, cuss her out, go all out her name because she charged you 10 cents more. That ain't nothing about the 10 cents. You are depressed and you feel like you have no one to lash out at, and this is who you lash out at, or you're always mad, you're always whatever. That is mental health challenges. And so we have stigma, we have, yes, you can talk about lack of education, but also lack of acceptance as mental health is physical health. And I will say this, there's a study out of Hopkins where you know that you can't treat that heart attack. You can't treat the diabetes well if you have coexisting depression. You understand? For real. So people are separating this, but we are mind, body, spirit. And if you don't treat depression, if you don't treat and you have diabetes, your outcome is worse. If you have a heart attack and you have a underlying mental health issue, your outcome is worse. Stroke, every stroke patient typically needs to be on an antidepressant coming after a stroke because of the neurochemical changes in the brain that occur after stroke. And when we start talking about that in large sessions, and I had a huge session for pastors and bishops several years ago with depression in our pews. And I will tell you this, it was about 800 pastors and bishops at a conference. And after I broke down depression and the symptoms and all that, I had bishops and pastors coming up to me saying, not only do you need to talk about church, but I think I'm depressed. My wife is, yes, wow. We are mind, body, and spirit. And so the other part, and I will end with this, but especially since we are faith-based, the church has not helped us in this area. It has not. It has in recent years. In the last 10 years, I've seen a big change. But if we're honest, the church has not helped us because you can pray away cancer. But you got to go to the doctor usually in the most churches they ain't crazy. They say go to the doctor, they'll bring in a cancer specialist, but they won't bring in a psychologist. They won't talk about mental health, and they will try to get the demon out of you if you have schizophrenia when you actually need some medication.
Wow.
Very
true. Well said.
Yeah. Wow. So that's why we love Dr. Jazz, because she has there's grief counseling group. There's a group for people who were addicts and whatever their vice was. So yeah, so she's definitely on that. She's in tune to that. She understands that. And we do offer a lot of those services at the church. But of course, we still recommend, if you want to call the church first, because that's what you feel comfortable with. But then they do, recommend them to outside sources. So you're right. The conversation has to continue for the stigma to be abolished, right? For sure. Yes.
Can I make a comment or a question for Dr. Oddie as well? So Dr. Oddie, I love what you said, because it's impossible to be healthy if your thoughts aren't right and your emotions aren't healthy, correct? Right. And so people can even be skinny and look good on the outside, but inside, if you got messed up thoughts and messed up emotions, by messed up, I mean unhealthy, then most likely you're going to have some issue with your health, some organ of some type, because you're internalizing stress and pain. So you can look good on the outside, but your inside is just very unhealthy.
Excellent. I couldn't have said it better. You're exactly right.
Yeah. So we definitely want to thank you both, Sarah Clark, for telehealth. And I'm sure when everybody watches this, they're going to be going through to see if their provider has it, because now they're like, oh, especially for the therapy part, right? Knowing that you don't have to leave, nobody's going to see you going in. Oh, she's going in that building, that's for therapy. What's she going in there for? Because that's how we do. We don't go, or we're taking to Facebook, right? And people who have no idea what you're going through can't give you any advice. So that's what they wait for. Because you get that a lot. You get people putting on there, you contact them. Sometimes either we call it say, or they just want attention, but no, they really do need some help. Yeah. So we just thank you both. Dr. Sharon, it's always a pleasure for you to come in and, give us your keeping it real. We love that, because that's how, when you go to school, that's what your teachers talk to you one way. And then if you get the Black teacher, right, they'll pull you to the side, like, I know this is what you know. They'll talk to you like that. So that's you. That's how I see you, Dr. Sharon. It's like, okay, this is what I'm going to say, but come on over here so I can tell you the truth and make sure that you do it. So we thank you both ladies so much for joining us this evening. This was a wonderful talk, and it's a victory evening. We thank everybody. Deacon Larry, anything else?
Yeah, so I just wanted to say to everyone, thank you for hosting Dr. Nicholson. Thank you, Dr. Sharon. Thank you, Sister Sarah. I've known for over 20-something years, so thank you for agreeing to come on. But I really want to talk to those people who may be listening to this and really need some help. You can go to victorygracecenter.org, and we have a whole lot of programs out there for you. Or I love what you said, Dr. Nicholson. They could call the National Suicide Prevention Hotline, and we want to give that number out. It's 1-800-273-TALK or 1-800-273-8255, because you're not in this alone. There is help out there for you, but you've got to ask for it because not everybody will be paying attention. So before you think about doing anything, please, please, please reach out for help because help is out there for you. So thank you all so much for tuning in tonight. Thank our wonderful guests, thank our wonderful host, and thank our wonderful, wonderful founder, Dr. Jazz, for just coming up with all of this wonderful insight into what we need. So I want to thank her as well, but more importantly, thank you all as well.